The first technique we're going to do, iliac crest, and I wanted to show the camera that I'm actually working right on the crest of the bone. Why the crest of the bone?
That's where the attachments are.
That's where the attachments are. The myofascia, or the different structures that cross the low back space, attach onto that crest. A lot of them. Our general goal, which you learned when you listened to the lecture before doing these techniques, our general goal here is to gently decompress the lumbar space. So I'm starting superficially. Stop me at any time if you can't see what I'm doing. Superficial layers, just a gentle glide. This second hand is just trying to stay out of the way of the camera and monitor what's happening. And then as those outer layers become a little more elastic, get warmed up a little bit, then I can focus right down on the bony attachments. So I'm coming in from above on the bone rather than from behind. And now that I'm down to bone, I actually wait in each spot too. That's going to get more of the Golgi response, the actual static touch, where I'm letting her body accommodate itself to my pressure. I'm thinking of the larger structures that cross both above and below. How's that pressure, Teresa?
Good.
The intention of the technique is preparation. Beginning the process of decompressing the space by working with the outermost layers, the superficial fascia, and in this case, the thoracolumbar fascia where it attaches onto the iliac crest. In other words, the attachments of the obliques, the transversus, and the big broad sheet of fascia that also attaches to the latissimus. Speaking of that, what would it be like to raise your elbow above your head, Teresa? Play with that idea.
This?
Yeah. So that adds a little tiny stretch here. Do you feel that?
Mm-hmm.
So you can come back with that. And then just raise your, I'm just going to have you lead with your elbow. So raise your elbow again and look for that connection into what I have there. Yeah, and so she's a body worker, so she breathes. But most of us need to be reminded that that's a great place just to breathe and wait. Pressure still tolerable? Still okay?
Yes, thank you.
Great. And I'm waiting till I feel a tissue change, till I feel some elasticity shift. Okay, and come on down with your elbow. Any questions? Great. The next technique, the lumbar space technique, we're working with the obliques. That is L5. Again, my general goal is decompressing the lumbar space. So I'm thinking of wrapping still. And I'm using a soft fist tool to continue working the layers we started with the iliac crest. Starting with skin. Working in these diagonal patterns to follow the fiber direction of the tissue that I'm working. How is that, Teresa?
Good, really good.
Okay. Still pretty much just skin and superficial fascia. Those are not a small thing, you know. They are very structural. There's lots of fiber, and there's especially lots of sensation, including both proprioception and sometimes pain or discomfort, where there can a lot of low back pain, even if it feels deeper, can be associated with these outer layers just under the skin. So working between my hands, feeling the stretch and the movement of the tissue, front to back. So in diagonals, both directions, unwrapping that midsection. Up onto the rib cage a bit in front. Might not be visible to you, but I'm actually feeling those wrappings where they extend up onto the ribs too. So that was the skin, and now I'm going to go just a little bit under that into the layer that includes the thoracolumbar fascia and the obliques. So I'm not pressing into erectors per se. I'm still superficial to those. Maybe I'm on the wrappings of the erectors. And then in front, I'm working with the abdominal wall rather than the viscera or the contents of the abdomen. It's just the wall itself that I'm wanting to gently unwind. And Teresa, what happens if you gently slide your top leg straight? So like reaching down with that right foot. What's that like on your side? Big breath. Looking for a sense of connection here. Go ahead and bend your knee again. Yeah. And then slide it long again. And feel for the way that opens this up there. So there's probably a bit of a stretch or a lengthening out of here. Is that accurate? I'm leading the witness a little bit. But
No,
okay.
yes.
All right. And then bring your knee back up. And we could also use the arm motion, play with that elbow thing like we did for your, again, looking for these long diagonal connections.